My name is Stefan Gijsels. I represent Europa Colon, the Association of Colorectal Cancer Patients in Europe. And we represent 44 organizations in 33 countries. I'm a cancer patient myself. I had colon cancer late stage 3 years ago. So I went through surgery and chemotherapy. And I'm alive today. I had the incredible luck to be treated in one of the best hospitals in Europe for cancer treatment. If I look at what I had in terms of good practice and I compare it to what's happening in other countries and other places, I feel extremely privileged to what I've experienced. And I want to make sure that patients across Europe get the same possibilities as I have received. Screening is one of our number one priorities, for the simple reason that if you're diagnosed in a stage 1, then you have 90% overall survival after 5 years, compared to 8 to 10% in stage 4. Apart from overall survival, it also is much, much cheaper. So if you're diagnosed in stage 1, you have simple surgery and not necessarily chemotherapy, so it costs 3,000 to 4,000 euro per patient on average. When you're diagnosed in stage 4, it costs on average 40,000 euro. We made a calculation: if everything, in an ideal situation, if everybody would be screened in stage 1, we would save 230,000 lives in the European Union and save 10 billion euro. Many countries have different practices, and we can all learn from what others are doing. So the more insights we have from the broadest perspectives, the more that we can improve the situation of patients across the region. I think Europe should continue to play a very important role in health. A lot has been achieved over the past decades, and I think it would be fantastic if the European Commission and institutions would continue in that way. So I think the European Commission has achieved a lot. I mean, they've worked in prevention, they've worked in screening programs, they've set up initiatives like CanCon, National Cancer Plan initiative. And for us, it's very important that the European Commission puts health very high on the agenda, because it's also very high on the agenda of all the citizens across the region. At the same time, we also want that all these wonderful plans that exist on paper and that have been agreed by the institutions and the member states are now also put into practice.